After being toilet trained, children with type 1 diabetes may begin wetting the bed. Type 2 diabetes, if left untreated, can lead to lifelong consequences such as heart disease, renal disease, and blindness. Proper nutrition and exercise can assist your child in managing their blood sugar and avoiding these issues. Type 2 diabetes is more common among young people than ever before. Diabetes, the most dangerous sign, CC. These medications work in a variety of ways to reduce your blood sugar. According to research, 30% of women who get gestational diabetes will need insulin to control their blood sugar. Insulin is not harmful to a developing fetus. The treatment plan recommended by your doctor will be determined by the kind of diabetes you have and its cause. If you are diagnosed with gestational diabetes, you must test your blood sugar levels many times every day during your pregnancy. If it is high, dietary adjustments and exercise may be enough to reduce it. You may need to take more than one of these medications. Insulin is also used by certain persons with type 2 diabetes. 1. Diabetes and nutrition. Your doctor may tell you to reduce the number of carbohydrates you consume each day. You must also manage your carbohydrate consumption with your insulin doses. Counting carbohydrates aids in balancing carbohydrate consumption with insulin dosages. The things you eat cause your blood sugar level to rise or fall. Blood sugar levels rise while eating starchy or sugary meals. Protein and fat generate slower growth. Check out this guide on getting started with a type 1 diabetic diet. Diabetes management begins with healthy eating. In some circumstances, modifying your diet may be enough to manage the disease. Type 1 and Type 1. Eat modest meals throughout the day to keep your blood sugar levels stable. Consuming the appropriate foods will help you regulate your blood sugar and shed excess weight. Carbohydrate counting is an important aspect of a type 2 diabetic diet. A nutritionist can assist you in determining how many grams of carbohydrates to consume at each meal. Some foods can undermine your efforts to control your blood sugar. Limit sugary or salty foods and watch your part amounts. Although you need some sugar to fuel your growing baby, you should limit your intake. More do's and don'ts for good eating with gestational diabetes can be found here. Learn which foods to avoid if you have diabetes. During these 9 months, eating a well-balanced diet is critical for both you and your kid. Making good eating choices might also help you avoid taking diabetes meds. If you have access to one, consult with a qualified nutritionist. They can assist you in developing a personalized diabetes food plan. Having the correct protein, fat, and carbohydrate balance will help you manage your blood sugar. 2. Diabetes symptoms. Type 1 diabetes, in particular, can lead to diabetic ketoacidosis if left untreated. This occurs when the body's ketones reach a hazardous level. Other types of diabetes are less likely to have it, although it is still possible. The symptoms of type 1, type 2, and type 1.5 are the same, yet, type 1 symptom appears sooner than types 2 and 1.5. Type 2 diabetes has a slower onset. Type 2 is more prone to tingling nerves and slow-healing lesions. Diabetes symptoms might be so subtle that they are difficult to detect at first. Discover which symptoms should prompt a visit to the doctor. The majority of women who develop gestational diabetes have no symptoms. The disease is detected by healthcare experts during a standard blood sugar test or oral glucose tolerance test, which is performed between the 24th and 28th weeks of pregnancy. A person with gestational diabetes may experience increased thirst or urination in rare situations. 3. Diabetes causes. Type 2 diabetes is caused by a mix of hereditary and environmental factors. Being overweight or obese also raises your risk. Having extra weight, particularly around the abdomen, makes your cells more resistant to the effects of insulin on blood sugar. This disease runs in families. Family members share genes that make them more prone to type 2 diabetes and obesity. Each form of diabetes has its own set of reasons. Doctors aren't sure what causes type 1 diabetes. The immune system assaults and destroys insulin-producing beta cells in the pancreas for unknown reasons. Some people's genes may play a role. It's also possible that a virus triggers an immunological response. Individuals who are overweight when they get pregnant or get an excessive amount of weight during pregnancy are more likely to develop gestational diabetes. Diabetes is caused by both genetic and environmental causes. Learn more about the causes of diabetes. Type 1.5 diabetes is an autoimmune disease in which the pancreas is attacked by your antibodies. like type 1. Further research is needed to determine whether it is inherited. Gestational diabetes is caused by hormonal changes during pregnancy. The placenta secretes substances that make a pregnant woman's cells less responsive to insulin's effects. This can result in elevated blood sugar levels during pregnancy. 4. Diabetes danger signs. If you smoke, your chances of developing type 2 diabetes rise. Some racial and ethnic groups are also affected by type 2 diabetes. According to 2016 research, adults of African American, Hispanic or Latino American, or Asian American heritage are more likely than white persons to be diagnosed with type 2 diabetes. They are also more likely to have a lower quality of care and more hurdles to self-management. Several variables enhance your chances of developing diabetes. You are more likely to develop type 1 diabetes as a child or adolescent, if you have a parent or sibling who has the disease, or if you inherit particular genes associated with the disease. Diabetes risk factors include family history, environment, and pre-existing medical disorders. Determine which hazards you can control and which you cannot. Type 1.5 diabetes is common in adults over the age of 30 and is sometimes confused with type 2, yet, patients with this illness are not always overweight, and oral drugs and lifestyle changes have little effect. If you are overweight, you are more likely to develop gestational diabetes. 5. Complications of diabetes. Excessive blood sugar levels harm organs and tissues throughout the body. The higher your blood sugar level is and the longer you live with it, the more likely you are to have difficulties. Diabetes complications include the following. The risk of gestational diabetes in after pregnancies rises as well. Diabetes can cause major medical consequences, but it is treatable with drugs and lifestyle modifications. Unmanaged gestational diabetes can cause complications for both the mother and the baby. Complications such as high blood pressure or type 2 diabetes can occur in a pregnant woman with gestational diabetes. You may also need cesarean birth, usually known as a C-section. With these helpful hints, you can avoid the most common diabetic problems. 6. Children with diabetes. The syndrome is also characterized by extreme thirst, weariness, and hunger. Children with type 1 diabetes must receive therapy as soon as possible. High blood sugar, dehydration, and diabetic ketoacidosis can all result in medical issues. Type 1 and type 2 diabetes can affect children. Hold on, everyone, wait a minute. I'm so tired. Diabetes can harm vital organs such as the heart and kidneys, thus controlling blood sugar is especially critical in young people. Diabetes autoimmune begins in childhood. Increased urination is one of the most common symptoms. After being toilet trained, children with type 1 diabetes may begin wetting the bed. Type 2 diabetes, if left untreated, can lead to lifelong consequences such as heart disease, renal disease, and blindness. Proper nutrition and exercise can assist your child in managing their blood sugar and avoiding these issues. Type 2 diabetes is more common among young people than ever before. Learn how to recognize the symptoms and report them to your child's doctor. Is gestational diabetes self-resolving? Because type 2 diabetes is so uncommon in children, type 1 diabetes was once known as juvenile diabetes. Type 2 diabetes is becoming more common in this age group as more youngsters become overweight or obese. Some children with type 2 diabetes do not have symptoms. A medical history, physical exam, and blood work are used to diagnose type 2 diabetes. Gestational diabetes should resolve after delivery, but it increases your chance of developing diabetes later in life. Half of those who develop gestational diabetes will go on to develop type 2 diabetes. I have some funny quotes about this disease I want to share with you for better mental health. For when you need that extra self-esteem boost. I'm not ill, my pancreas is just lazy. I'm as healthy as a horse, if that horse has diabetes. Don't mess with me, I attacked my own pancreas. Giving birth while playing cards is one of the most dangerous symptoms of this diabetes. I hope the above knowledge will be of some help to you, your friends and family. Wishing you and your family good health with loved ones and friends. Thank you for watching the video. If you find this video useful, please like and share to help more people know. Any questions, please leave a comment below the video. Please click subscribe and press the notification bell to support me. Lolo.